That's a great question. I feel like I looked this up, and there's 50 something programs that actually do have some
Ah,
element of
quite a few.
narrative
Quite a
medicine. So
few.
there's quite a number that do. Now, when you look at some of those programs, are they practicing narrative medicine in the way that I'm describing it? Maybe not exactly. So I've looked up some of the narrative medicine curricula, and some of them involve reading short stories ahead of time. So people can come ready to discuss the story. They've had a little bit more time to absorb it in advance. And many of them are using just written, so just short stories, or maybe poetry and short stories in terms of their texts for interpretation. So they're using narrative in more of the written form. Um, but as I was researching for the Grand Rounds and for the presentation that you saw on Doctors on Social Media, I also found that there were examples like at Yale University where they were taking medical students to a museum and looking at 18th and 19th century artwork and asking students to describe what they saw there. And the idea behind that is that as students were asked to describe something unfamiliar, they actually were able to hone their perception and hone their description in a way that was not truly medical, but allowed them then to translate that into their description of, for example, lesions in dermatology. It was a dermatologist who pioneered that.
Hmm.